Hello, everyone. Hello, this is Bob Miglani.
And this is Dr. Shefali Miglani.
Happy New Year. We are talking to you today to wish you a Happy New Year, but we want to share some advice and tips and strategies about the most important thing to achieve your goals for this year. You're running an optometry practice, you're running a ophthalmology practice, dentist practice, or whatever practice, medical practice in specialty care, and you want to get more patients converted into your specialty treatments. So let's talk number one, Shifali. Let's share with them five things that they should be thinking about and doing to get a really successful, happy 2025 for them. What do you think?
Well, first is have a clear goal in mind for your practice. Write it down, why it's a must, why this goal matters, whether it's a revenue goal, profit goal, freedom goal of having more time off for you or your staff, whatever it is, write those goals down. Share those goals with the key people in your practice. I share those goals with everybody in my practice and a Monday during the Monday morning meeting, and and then we synergize our efforts to achieving those goals. Um, I believe in that
Yeah.
writing down the goals
So
of
you're talking about revenue goals. We're talking about revenue
anything.
goals. We're
Yeah,
talking about number of patients signing up for certain goals. But
correct.
yeah, a revenue goal. I think that's
Yeah.
very important. I think one of the tips, so let's talk about the goals for a second. One of the books I read recently is called 10X is Easier Than 2X. It's by Dan Sullivan and Dr. Benjamin Hardy. 10X is easier than 2X. And one of the key propositions is that, you can grind your way to the first million, but you can't grind your way to the next 10. And what that means is you can't think of doing the same old thing, and adding 20% or 30% year of growth. That's not good enough. You've got to have bolder, really hard goals because all of the crap that we do will shift away.
Mhm.
You're really going to be able to focus on one or two things that are going to be really important to get to that big goal. So you might as well focus on that big goal and let the 80% wash out. So very important is to have a big goal.
Yeah.
What's the second thing that they could be doing?
Well, take massive, determined action. So you have to move heaven and earth to get your goals. So take massive action. Get up earlier, exercise earlier, get in your office, call that pediatrician down the street to give you referrals, shoot videos, podcasts, do external marketing, whatever it is. You have to get out of your comfort zone. You have to do things differently than you did last year so you can get different results. And there are certain actions,
Mhm.
the 20% of the actions during, that Pareto's rule, 20% of your actions will get you the 80% benefit. And that's what Bob is talking about. 10x is easier than
2X.
2x is the determined, find out what actions and the tasks that you can do to really get that leverage of the result that you want,
Right.
massive result that you
Yeah.
want. But taking
Taking action.
consistent massive action is very important.
There's a great book called Atomic Habits. I don't know if you read it, and it's by James Clear. I highly recommend it. I listened to it on an audiobook. And one of the things he says is that there's a difference between motion and action. Motion is, hey, I'm going to work on this presentation. I'm going to do this. I'm going to shuffle the papers. I'm going to write a nice email, write a document. That's getting in preparation. Hitting the send button is action. Making a call is action. So thinking about doing something or getting the motion. Sometimes we're just like satisfied by a little bit of like doing something so that we feel like we're making progress. But real progress, you feel so much better when you take the action, which means signing up for a course, signing up for a program, signing up, booking the flight. One thing is to say is, hey, yes, I want to go to Italy this year. We'd like to go to Italy. Well, we go to this place, that place, that place. That's motion. Booking the flight, the hotel, setting a date where you make a financial commitment so there's no turning back. That is action. So that's really action. I think it's action. The other thing that happens, Shivali, I think I found is that when you take action, something really magical happens. You get a consequence. Either it's bad, it sucked, or you failed, or you didn't do great, or it was good and you got some positive return from it. At least you know. There's so much anxiety today that we have about not taking action. You sit on it and it's just anxiety, anxiety, anxiety. Well, anxiety goes away when you take action, and
Yeah.
that's really something powerful. So, what's the third thing that you want to share?
The third thing I had in my mind, but well, that reminds me, to your point that, what holds all of us back is the fear of failure.
Yeah.
And just dissociating yourself from the pain of failure and actually taking action. Yeah, this is what my point is, that you don't want to just take any action, you want to take intelligent action.
Yeah.
Okay. You want to be First of all, you dissociate yourself from the pain. So I had to exercise this
Yeah.
morning. Instead of saying, oh my gosh, it's going to be really hard to get on the Peloton, etc., I say, you know what? You just have to do it,
Yeah.
because you become, number three is you want to become outcome focused, not
Yeah.
task focused. Okay. So when I focus on my outcome of what getting on that Peloton bike means for me, is I will feel healthy, I will feel victorious, I will feel ready for the day, and dissociate myself from the task of doing the Peloton exercise that involves pain and discomfort, I can actually go and sit on that bike because now I'm outcome focused. So you can do that in your work as well, because if you let's say it's a dry eye
Yeah.
clinic that you have, myopia clinic you have, glaucoma clinic you have, you can have separate outcomes from that, and encourage your staff to become more outcome focused. When I ask my staff, I absolutely hate when they say, well, I called for the pre-appointments. Well, I don't want to know what you did. What was the outcome
Right.
that
Did
we
the
were
patient show
after?
up?
Did the patient get in the chair?
Yeah.
Did they get themselves in the chair for me to actually do the follow-up? That is the outcome. So I'm training my staff to do that. I am training myself to do that, to become more outcome focused and not
Yeah.
task focused, because
Yeah.
being task focused can make us really tired and haggard.
Mm.
But if you're outcome focused, your outcome for your life, about your career, about your family, about your practice, those goals are much easier to achieve, and easier on our lives. We don't get bogged down. We don't get bored. We
Yeah.
don't get. We're pulled toward
Yeah. I think I love
pulled
the
towards
outcome.
that.
I think that's really powerful. So, for example, one of the examples I've given in the past is you want to outcome focus versus goal focus. Goal is I'm going to lose 10 pounds, right?
Hmm.
Outcome focused. Goal focus will be get you only till like February to go to the gym, right? Because you're like, I'm rowing this boat, I'm running, I'm like, it's so freaking cold outside, right? So outcome focus is, hey, by Thanksgiving, I want to come downstairs to meet my family. I want to wear the best pair of jeans and fit in my jeans that I've been trying to fit into. And I want everyone to look at me and say, holy cow, Bob, what did you do to lose all that
And
weight? It's
how
amazing.
is that going to make you
Make it feel
feel?
great.
Actually, the most important outcomes that you can achieve is how intrinsically it changes
Sure.
you,
Yes.
not what you get out of from the
Right.
world. It's how it makes you feel, because you become a different person. You will act like a different person if you exercised most days of the week, and you looked a
Right.
certain way at the end of, 2025, or your practice looks a certain way at the end of 2025, but consistent, massive action that is towards outcome
Outcome
that you
focus.
want.
Yeah. And also, I know from a number of doctors I spoke with over the years in the WHO community, they said, Bob, one of the most important things I've gotten is become more confident.
Yeah.
Right? And that confidence plays out in their personal lives
Hmm.
as well as their professional lives. So it's
Hmm.
not just about being confident to do myopia management, do dry eyes and and all that and sclerals and all the other things, but it's like I'm more confident as a speaker to my patients and my staff.
Yeah.
I've raised the bar. I've become somebody different.
Yeah.
So I say, so number four, I have a number four tip, which is, it's a lot of doctors are operators.
Hmm.
And I think the big shift that doctors and all of us need to make as business owners is to be a business owner.
Hmm.
It's to shift the hat of being a doctor and clinician where all we're doing is going after next patient, next patient, next patient, next patient, next patient. And then you're in this vicious cycle, right? They're in your hamster wheel of exams, 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 and so on. What we need to move towards is being a business owner. And that gives you a lot of freedom. But what does that mean? What does that look like, Shefali? How do you become a business owner? And what does that feel like?
I think I'm in the process of becoming a business owner. I see far less patients that I did a couple of years ago. And it's not about seeing less patients, but it's about making space. So in the beginning, it's hard well, the fifth thing I would say that kind of weaves into your point is that you need to be a no you need to be comfortable with saying no. So
Hmm.
saying no to
Yes.
activities and other people's agendas that don't fit into your outcome, you have to be very comfortable in saying no. For example, I had a text yesterday that this woman wanted to meet with me and just to socialize. It was a Zoom call just to kind of get to know each other, networking call. And I said, well, you know what? That doesn't feed into my outcome in the next 3 months. And I rescheduled that call for March, April, because we have many opportunities to see each other in the next, this coming year. So I said, let's do it in March when, I'm more free and I have, certain goals, I have certain outcomes that I need for this 3 months. And she completely understood. So it's not about being rude, but it's actually creating space in your life, in your schedule. So creating space is very
Yeah.
important, and saying no to things is part of it. So let's say, what does that mean for your practice? Don't have a full schedule. Create space in your schedule to have some free time, thinking time, to strategize, to sit in your chair, think, write, jot down whatever comes to your head, make your outcomes, make your goals, and just maybe just think, have
Yeah.
space. That space will allow you to say yes to other opportunities that come your way that can meet your outcomes much faster.
Yeah.
Okay?
A lot of, I think the badge of honor, a lot of us business owners, doctors, and entrepreneurs face is that our schedule is so full. And the truth is, that is a poor marker of success
You're
when
just a slave to your
you're
practice
a
then.
slave to your business, you're a slave to patients, you're a slave to your practice, and that is not the source of success.
Yeah.
I walked into a clinic the other day recently, and the doctor was super busy. He has several associates and all that, and he's like running from one place to another. And that's not success. What we want is to be able to have the free time. So it's okay. It's okay to have nothing on your calendar so that you can run the business,
Hmm.
not operate in the business. You've got to run the business, and business owners treat businesses a little differently, right? They're an entrepreneur, not an artist. Artist is somebody who's like creative and very much so and created the business and just enjoys the art of it. But they're not running a business. They're not an entrepreneur. An entrepreneur is somebody who runs a business, detached from the business and but the business gives them. So I think that's really important is not to overcommit, have some free time so that you can be a business owner, to think about strategy. And so one of the things I learned in that 10x is easier than 2x book is that this in entrepreneurs, really successful entrepreneurs, give themselves like 30, 60, 90, 100 days of free time because in that free time, they will create, they will develop ideas, they will learn and become somebody different. So that when they go back in, they know exactly what to focus on. They're focusing on that. They take massive action. They get outcomes that they want because they're focused on the outcome, not in the motion. And I think that is the true way to grow your business. So I think with any last minute thoughts for our
Yes,
customers here, our
last minute
partners.
is beware of who you hang out with. Proximity is power. Beware of what you listen to, beware of what you watch. Watch things, listen to people, be with people that you want to be like. Okay, so that's the last thing I'm going to say, is
Wonderful.
because that's going to affect the entire year and your entire life. Is proximity is power, and surround yourself with people that
Yes.
you want to be like
Yes.
more than anything. And and that goes with
Yeah.
what you listen to, who you spend your time with and give your time to,
That's right.
is very important.
Yeah, you spent a lot of time last year doing personal development, and you spent with high performing. You were part of the Tony Robbins program, platinum program, and so you got a chance to spend a lot of time with high quality, successful people all from all over the world, hundreds of them.
Yes.
And so I think you've changed, I think, over the last year in your personal
Well,
development,
thank you.
and I see that, I can see that, I can sense that when you walk into your staff and your customers, your patients today, it's a lot different than it was a few years ago. And so I think this is really remarkable.
One
So
of the things that happened to me, that instead of going into my warrior mode when I entered my practice of being a warrior and wanting to just, the high strung, stressed out person, I went into just a more loving, more accepting place. And I actually am able to achieve much. My staff is way happier. They're producing while I'm here shooting this video for
Yeah,
you,
yeah, yeah.
and they're seeing patients, and it's just
Yeah,
wonderful.
but
So,
it's not. But see, a guy looks at that, what you just said, by the way, as I know this is a long goodbye, but guy looks at that and says, loving. Dude, I'm not loving. Loving means soft. Loving me soft means I'm not being successful. So, and
mm,
actually, that's not the case.
no.
It's really saying, I understand what my team needs, and I give them what they need. And
Hmm.
when I give them what they need, they will perform. And
100%.
it doesn't mean that what they need is a push. Sometimes they need a pull.
Hmm.
Sometimes they need, a little TLC. Sometimes they need some direction. Sometimes they need strategy. Sometimes they need support.
Hmm.
Sometimes they need instruction, right? That doesn't mean that. It just means that you have to recognize what they need, to have awareness of it, and then give them that. So this is not about being soft and, loving and la-di-da, kumbaya. It's really about performance. How do we get all of us this year to our peak performance, to a place where we can grow our lives richer?
Yes,
So
and
to
nothing
me,
is perfection. It's just progress. So just keep working at it, whatever, success looks to you. Um, just working
go for it.
toward, keep working, keep taking consistent, massive action towards
Wonderful.
that.
Thank you, Shefali. Thank you, Dr. Shefali Miglani. This is Bob
Thank you.
Miglani. Thank you for your time. We wish you great success and love for this 2025. We thank you for your business being a part of the Hoot community, and we wish you very good success year for this year ahead. You're going to have a great year. Let's keep it going. Thanks very much. Have a great day.
Thank
Bye.
you. Bye
Bye.
bye.
Bye.